Neuromyelitis Optica Spectrum Disorder, or MOSD, is a rare autoimmune disease that primarily affects the optic nerves and the spinal cord. In this video, we'll explore this complex condition, shedding light on its causes, symptoms, diagnosis, and available treatments. Understanding MOSD is crucial for those affected and their loved ones, as well as for healthcare professionals involved in their care. The precise cause of MOSD is not fully understood, but it's characterized as an autoimmune disorder. This means that the body's immune system mistakenly attacks its own healthy cells. In MOSD, the primary target is believed to be aquaporin 4, or AQP4, a protein channel found primarily in cells of the central nervous system, especially in the optic nerves, spinal cord, and brain. While genetics may play a role in some individuals, MOSD is generally not considered to be directly inherited. Certain environmental factors or viral infections may act as triggers in susceptible individuals, initiating the autoimmune response. The underlying process of MOSD involves an abnormal immune response targeting aquaporin 4, a water channel protein vital for maintaining fluid balance in the central nervous system. When antibodies, specifically AQP4 Ig antibodies, bind to aquaporin 4, it triggers a cascade of inflammatory events. This leads to the destruction of astrocytes, a type of glial cell that supports neurons. The resulting inflammation and demyelination, or the loss of the protective coating around nerve fibers, disrupts nerve signal transmission. In the optic nerves, this damage causes optic neuritis, leading to vision problems. In the spinal cord, it results in transverse myelitis, which can cause weakness, numbness, and bowel or bladder dysfunction. MOSD is considered a rare disease. Prevalence estimates vary, but it's thought to affect between 1 and 5 people per 100,000 worldwide. While it can occur at any age, it's more commonly diagnosed in adults, particularly women, with a female-to-male ratio of approximately 9:1. MOSD is found in various ethnic groups and geographical locations, although some studies suggest a higher prevalence in certain populations, such as those of African or Asian descent. The symptoms of MOSD can vary widely depending on which parts of the central nervous system are affected. Optic neuritis, or inflammation of the optic nerve, is a common symptom, causing blurred vision, eye pain, and sometimes complete vision loss in one or both eyes. Transverse myelitis, or inflammation of the spinal cord, can result in weakness in the arms or legs, numbness, tingling sensations, muscle spasms, and bowel or bladder dysfunction. Other symptoms may include nausea, vomiting, intractable hiccups, and endocrine abnormalities due to involvement of the area postrema or hypothalamus. It's important to note that symptoms can develop suddenly and progress rapidly during an attack, or they can develop more gradually over time. Diagnosing MOSD involves a combination of clinical evaluation, neurological examination, and diagnostic testing. A key diagnostic marker is the presence of AP4 Ig antibodies in the blood. Magnetic resonance imaging, or MRI, of the brain and spinal cord is crucial to identify lesions characteristic of MOSD. Specifically, MRI of the optic nerves may show swelling and enhancement, while spinal cord MRI may reveal longitudinally extensive transverse myelitis, or LTM, lesions spanning 3 or more vertebral segments. Visual evoked potentials, or VEPs, can assess the function of the optic nerves. Cerebrospinal fluid analysis can also provide valuable information. It is vital to exclude other possible causes of similar symptoms, like multiple sclerosis. MOSD can be broadly classified into 2 main types: MOSD with AQP4 Ig antibodies and without AQP4 Ig antibodies. Individuals with AQP4 antibodies have a high likelihood of relapses and may require long-term immunosuppressive therapy. Those without AP4 Ig antibodies, also known as MOGAs, at myelin oligodendrocyte glycoprotein antibody-associated disease, often present with different clinical features and may have a different disease course. MOGI can be associated with acute disseminated encephalomyelitis and edema and optic neuritis. Accurate distinction between these subtypes is crucial for appropriate treatment strategies. The treatment of MOS focuses on managing acute attacks and preventing future relapses. Acute attacks are typically treated with high-dose intravenous corticosteroids to reduce inflammation. Plasma exchange, or plasmapheresis, may be used in severe cases when corticosteroids are not effective. For long-term management, immunosuppressant medications like azathioprine, mycophenolate mofetil, rituximab, and tocilizumab are often prescribed to suppress the immune system and reduce the frequency of attacks. Eculizumab and satralizumab, which target specific components of the immune system, are also approved therapies for preventing relapses in patients who are AQP4 Ig positive. Symptomatic treatments such as pain relievers, muscle relaxants, and physical therapy are important for managing the effects of the disease. Currently, there's no known way to directly prevent MOSD. However, minimizing exposure to potential triggers, such as certain infections, may be beneficial. Early diagnosis and prompt treatment are crucial for preventing long-term disability and improving outcomes. Vaccination safety is a complex issue, and patients should discuss the potential risks and benefits of specific vaccines with their healthcare provider. It's essential to maintain a healthy lifestyle, manage stress, and follow a comprehensive treatment plan as prescribed by a neurologist or MOSD specialist. The prognosis for MOSD varies depending on the severity of the disease, the frequency of attacks, and the effectiveness of treatment. Early diagnosis and aggressive treatment can help minimize the risk of permanent disability. Some individuals may experience a relapsing, remitting course with periods of stability between attacks, while others may have a more progressive form of the disease. Recent research has focused on understanding the specific immune mechanisms involved in MOSD, identifying new therapeutic targets, and developing more effective treatments. Clinical trials are ongoing to evaluate the safety and efficacy of novel therapies, offering hope for improved outcomes and a better quality of life for those living with MOSD.